So our next speaker today, which would be our first speaker, does not need so much introduction because we know him. He is a father, and for my age, like for the Gen Z vets, we call him the veterinary grandfather in Nigeria. So I want you to welcome with me Dr. Gani Enahoro, who is an accomplished veterinarian and international animal health leader. He has extensive experience spanning clinical practice, policy, leadership, and global animal health systems. Very quickly, I will be reading a bio of Dr. Gani Enahoro. He's, as I said earlier, an highly experienced veterinarian and animal health leader with strong expertise in veterinary practice, policy, and international advisory work. He currently serves as a senior advisor animal health at the Food and Agriculture Organization and holds key global leadership roles, including Counselor for Africa and chair of the Policy Committee of the World Veterinary Association, as well as membership of the Veterinary Council of Nigeria. He has previously led major professional bodies such as Nigeria Veterinary Medical Association and the African Veterinary Association. Along his international roles, he runs Gan Rovet Nigeria Limited and Gan Rovet Animal Hospital, combining clinical practice with research, training, and capacity building in animal health systems. With growing engagement in digital and data-driven innovations shaping modern veterinary practice. Ladies and gentlemen, doctors, animal health professionals, animal lovers generally, innovators, researchers in the room, join me to welcome Dr. Gani Enahoro. Please just use your favorite clapping emoji to welcome him. We are so honored to have him in our midst. Thank you so much. You're welcome, sir.
Yes, so Dr. Gani will be speaking on preparing young animal health professionals for the AI era. Sorry, I beg your pardon. Dr. Gani will be speaking on staying adaptable as veterinary professionals in the AI era. This is one session you don't want to miss because it's well packed, it's well loaded. Please get your notebooks ready to listen to our father, to listen to our daddy, Dr. Gani. Thank you so much, sir. Please, are you there now?
I'm here. Good afternoon.
Good afternoon, sir.
Good afternoon, sir. Welcome and so good to have you here again.
Thank
You have the
you.
floor, sir.
Okay. I hope I can share my slides. Um, it's my pleasure to be here again today. And the topic of my presentation, are you seeing my screen?
Clearly,
Yes,
sir.
sir.
Staying adaptable as veterinary professionals in the AI era. Remember, we are veterinarians, so if I mistakenly refer to artificial intelligence as artificial insemination, I'm sure you will pardon me, because we are used to AI as artificial insemination for many years, isn't it? So The outline of my presentation will be an introduction, why this topic matters, what AI is and what AI is not, and how AI is changing veterinary medicine, thriving in a rapidly evolving digital landscape, and the rest is as shown on the screen. So I'll go straight into introduction. Why do we have to discuss this at all? Artificial intelligence is entering diagnostics where we operate, surveillance, livestock manager, and One Health. Am I still being heard clearly?
Yes, sir. We can hear you clearly. Thank you.
Okay, that's fine. Yeah. So veterinary roles are evolving faster than ever. Veterinarians are beginning to do many things in different areas of this livestock sector, much beyond the way we were trained in the past. And therefore, adaptability to new things is a core professional competency now. So Africa's veterinary systems face unique challenges and opportunities. If you look at it at in the broader scope, so I will take it straight away that AI are tools that learn patterns and assist decision making. So AI is learning so much. It's a student as well. It's not perfect, but it's very quick and fast in learning and assisting us in our decision making. AI depends heavily on data quality and context. What you put in is what you get. That is, garbage in is what you garbage out. And it's not a replacement for veterinarians. It will never be. Because, like I said yesterday, AI will not issue us certificates. They will not train us to be veterinarians. Even if they do, with the information they have, they will not give certificates to us. So AI works best when combined with human judgment. We had much of this yesterday when Dr. Prosper told us about how AI does not have a emotive component, does not have, will not show empathy in any way. And so we'll just go straight to what he knows. Now, we are thriving in a rapidly evolving digital landscape. And there is no meaningful development that will take place in any country without the contribution of technology that is driven by AI today. If you look at these pictures, those pictures here, you see a lot of activities going on. People are not resting. Work is being done. So we have to just find a way to key into this because it is the in thing. So in the African context, also, AI, if you look at that map, you will see with those highlighted buttons the spread of AI's acceptance and adoption all over the continent. So it's not just the spread is magical and phenomenal actually, because like I said, AI is into diagnostics now, surveillance, productivity, and One Health is also all adopting the AI now. So in the African context, first we must recognize that there is a high mobile penetration, even though digital infrastructure differs from one part of the continent to another. Like I said also yesterday, that I had the privilege of having traveled a lot within Africa, of course, and beyond. And I know that we cannot use the standard of Nigeria to gauge what is average in Africa at all. But I know that mobile penetration is very high across Africa anyway. There is also a strong community-based animal health network now. I have a relationship with veterinary paraprofessionals, training them for Food and Agriculture Organization of the United Nations. And I know that right in the last mile, we have a lot of community-based animal health workers for which we need to begin to also entrust some of the things we do by supervising them and owning the procedures that they also present. So we have a limited AI literacy among professionals. If you look at the entire groups and the entire ladder of those who take part in livestock sector. So we shouldn't use the veterinary component alone to judge what exists in the livestock sector. There is a growing interest also from ministries, universities. Yesterday, Dr. Ibukwe, she a professor from Maiduguri, told us yesterday we should not leave them behind in the universities. As researchers, they also need whatever knowledge of AI, wherever it is being discussed, we should always remember to invite them into it. She said that yesterday. So there is a growing interest across the board, and that's very fascinating. Therefore, there is a huge potential for mobile first AI solutions. So, in the African context, we are not lagging behind. The only difference is that we are not spearheading some of the advances that have taken place already in that space. But I must confess that we are not doing badly. I was in South Africa for a conference of South African Veterinary Association in 2006. And in one of the sessions, there was a presentation on researches going on that would make the use of emails irrelevant. Yesterday, Femi mentioned something very close to that. I wish I documented it. Femi said something like, very soon that our thoughts will determine, let me see. Anyway, at that, Femi said, our thoughts will control our activities in the house. And I just remember that seminar that I attended, that session. And it was the researchers came to present what their findings so far was by planting in chips in the body of a man, actually in the back of the head, maybe whatever this term they called it. And all you need to do is to have a thought, to think about sending an email to, what's your name now? And then it registers with you without my punching anything. It was a pin drop silence in that hall. Anyway, that's almost 20 years ago, and I can tell you the research is still going on. So, which means really the quickness of technology is such that we just have to find a way to catch up with the speed. So, what opportunities do we have as African veterinary professionals? That includes the paraprofessionals as well. We have improved diagnostic accuracy and speed, better surveillance of
Okay, Dr. Titi, am I the only one that can't hear Dr. Gani furthermore anymore?
Oh, well, at some point, I thought it was my network. I was about checking my Wi-Fi. I think we lost him for a moment.
Let's play that. Okay, I think while we wait for Dr. Gani to rejoin, I think he's having a bit of network issues. So our media team, we played that AI interlude. It's such an inspiring piece, and I really wish we watch it again. Thank you.
Yeah.
Every heartbeat matters. Every life counts. Across Africa, millions of animals depend on the decisions we make today. Imagine detecting disease before the first symptom appears. Imagine giving every farmer access to expert veterinary insight. Artificial intelligence is making that future possible. through faster diagnosis, real-time monitoring, and predictive animal health care.
From livestock farms to wildlife conservation, AI is improving animal welfare while strengthening food security across Africa. Technology will never replace compassionate veterinarians. It simply gives them better tools to save more lives.
Together, researchers,
Innovators, students, and policymakers are building a smarter future for animal health.
welcome to the African Animal Health AI Summit. Together, let's shape the future of veterinary practice in Africa. Every heartbeat matters. Every life counts. Across Africa, millions of animals depend on the decisions we make today. Imagine detecting disease before the first symptom appears. Imagine giving every farmer access to expert veterinary insight. Artificial intelligence is making that future possible through faster diagnosis, real-time monitoring, and predictive animal health care.
From livestock farms to wildlife conservation, AI is improving animal welfare while strengthening food security across Africa. Technology will never replace compassionate veterinarians. It simply gives them better tools to save more lives.
Together, researchers,
Innovators, students, and policymakers are building a smarter future for animal health.
welcome to the African Animal Health AI Summit. Together, let's shape the future of veterinary practice in Africa.
Yeah, I'm back now. Yeah, sorry about that. Yeah, thank you. Let me share my screen. Yeah.
Welcome back, sir. Dr. Gani, can you hear us?
Yes,
sir?
I can hear you. Sorry about that. I will share my screen now.
All right, sir.
The network just dropped off, so I've just changed to another network.
All right.
See. Okay, are you seeing my screen?
Yes.
Yes, sir.
Okay, my apologies. The network just dropped. Oh no. Let me see where I was. Let me see. Sorry, I was discussing the African situation, and I was talking about the opportunities that we have. I think I've already passed this level now. So I was saying that the future starts here. Am I correct?
Yes.
Hello, are you hearing me? Yeah, okay. Yeah, so that we all need to take the opportunities therein in AI and then adapt to its usage. What are the core skills for the AI-ready vet? One is digital literacy. We need to understand the basic AI tools and data systems. Very important. They are critical skills. We also need to with AI, develop the capacity to question their outputs and avoid a blind trust. That's critical thinking. We need to know how to do data interpretations whenever they're presented. We should be able to read dashboards, trends, and alerts. And then, of course, very important because we are veterinarians, ethical reasoning. We have to navigate privacies, particularly those data that are across the boundaries that we have to use. We need to be able to apply them with wisdom such that they will meet what operates in our client. We mustn't take some of those information wholesale and then become wrong in our outcomes when we apply them locally. So accountability is very important. Then we also need interdisciplinary collaboration as a core skill for the AI-ready veterinarian, that is working with data scientists, public health teams. A lot of these can be expanded, but let me just go on now. The questions will come around them. Then we must have the continuous learning mindset, that is embracing change. Because like I said, technology is not stopping and waiting for us. How is AI changing veterinary medicine? One, we now have the automated disease surveillance and early warning systems firmly in place. We heard much about this yesterday when the NVMA president, Dr. Arokoya, was making his presentation. Of course, we have the AI-assisted diagnostics. You have your imaging, you have your X-rays. If you feed it into AI, your lab results, they will likely give you clear options that will match the situation you are handling. If they have the knowledge of what you are doing, and most times they already have so many information in their data bank. Then we have precision livestock tools, behavior monitoring, feeding optimization, then predictive analytics for outbreaks and resource allocation. All of these, including One Health enhancement, are all possibilities within AI era now. But staying adaptable, that's what really concerns us this afternoon as veterinary professionals in this season of AI. Why should vets adapt to the use of AI? Well, technology will keep evolving, we said it. So if we don't catch up, they will leave us behind. New workflows and tools require new skills. In other words, we must jump on the train. We don't want to be left behind. Ethical and regulatory landscapes are shifting. A lot of grounds are being yielded now. There are many things that were not imaginable in the past, but now a lot of considerations are given to them because of what they expect us to know as professionals. And vets must stay relevant, confident, and capable. Adaptability, therefore, protects both animal health and the professional identity. We have to be there. We don't have to be just in the menu, we have to be on the table. There are new career paths, digital epidemiology, AI augmented feed practice. You can sit down in your office and you can you can construct models for a farm that is burgeoning or that is trying to start. And then most times you won't be out of place. I've tried it and I tell you it works. It is an improvement on the telemedicine, televeterinary medicine that we used to revile a lot. With AI modifications now, a lot can be done in adapting it to our daily use. But we must ensure that our AI tools fit African production systems. It's very important because most of the feedings, most of the sources of information that runs and operates the AI models of today are not Africa biased. We are just trying to make modifications around them. So what are the practical ways that we have to stay adaptable as veterinarians? First, we must engage with digital reporting tools and mobile apps. We must participate in training on AI, just like we are doing here today. Training on data and digital epidemiology. We must use AI as a support tool, not a decision maker. That decision still rests with us, but it must be a supporting tool for us to be able to improve the decision we make quickly. Unlike in the past that we wait a lot, but I mean, now we can make very quick decisions using AI as a supporting tool. Okay? And we should join professional networks on digital transformation. Wherever discussions are being held, there are new things to learn. For every day, there are new things that is being added to the knowledge from AI. And we should be advocates for ethical and context-appropriate AI policies. In other words, we must be part of the shapes that AI will take. We shouldn't just be users alone. We should also be able to relate how AI supports our livestock economy, livestock entrepreneurship, and generally the livestock sector where we operate. And we must practice in fact, in anything we do on AI, it's good for us to humanize our relationship. Once you want to make any inquiry, you should ask AI to humanize it for you. In other words, it should make it look like a man-to-man talking to themselves. Now, what the veterinary authorities should also do to support us. Yesterday, I talked a lot about how our administrators like the hard copies a lot, paper movement from one point to another. For what reasons, I don't know, but we must begin to change that orientation now. Our authorities should invest more in digital animal health information systems. I'm happy that the Veterinary Council, where I'm a member, we are already doing a lot of digitization now. We started it in the last dispensation. It's going on now, which is very helpful to, and of course, also backed and supported by AI applications. We should build AI and data skills into veterinary curricula. Yesterday, I talked about the school veterinary curriculum a lot because we need to train the trainers, teachers, our lecturers also must be very well grounded and trained to be able to accept what the students would have to present, supported by AI opportunities. We should develop clear policies on data governance and ethics and support research and local AI innovation and strengthen cross-border collaboration for One Health and also for transboundary disease controls. In conclusion, I will just make these concluding remarks that AI will not replace veterinarians. Dr. Aruko said as much as this yesterday. But veterinarians who use AI may replace those who don't, because the knowledge gaps will be there, and you can see the gulf there. What has separated these two, if you look at they are like mirror images of one for another, but they are not the same. To those on the left side, they have a knowledge gap which they have to fill to be able to look like those on the right side. So that is very important, that we must all make every effort to, but we need to have some carefulness. There are risks that we need to watch out for. We should be mindful of poor quality or biased data sets when we generate them. We must not also over-rely on AI tools. We still need to do those basic things that we used to do without AI. I used to refer to them as native intelligence. They also work a lot. Street wisdom, they also work a lot. AI will not understand what streetwise is in Nigeria, but we can apply that to override whatever errors that AI may generate for us. And digital exclusion of rural vets and pastoralists we should be mindful of that we have other members of our livestock sector who don't have access to the volume of information we have using AI. So in relating with them, we need to bridge that gap in a way that we uplift them, but we must also speak languages that they understand. Weak governance and unclear accountability, no, we shouldn't be part of that. Misuse of surveillance data, we should avoid that. We should keep our human expertise at the center of all of this. Just like I said, I referred to Dr. Prosper yesterday, we must make sure that our expertise as veterinarian is not tampered with by whatever external knowledge that AI will give to us. And we should ensure that the AI tools we use or we review must fit our African production systems. If we don't do that, we will look like a client of mine who told me because he read that in Australia you need to give a tick bath to bath your dog, chemical bathing twice in a year. And he came with a smelly dog to the clinic. And despite all the advice that he should have baited this dog and groomed the dog before coming, and we were offering it as a service, he started arguing that the knowledge he has is that you can only bait dogs twice in a year, forgetting that the circumstances in Australia, I had to probe to find out where he got the knowledge from. And he said it was an article which he read. And when I looked through, I discovered that the author were talking about situations around Australia with very cold temperature environment. And here we are with temperatures that is now scaring the Europeans, you see. So we must make sure that we are not lost in totally believing what AI presents for us. And we should prioritize our ethics, animal welfare, and of course, cultivate farmer trust. Like I said, we must use languages that they understand. And of course, we shouldn't say because we have AI and then we now reduce the young professionals who are supposed to work with us, believing that they will add more pressures to our bills. No, careful with this. But AI have to serve for us as a bridge. Like the red image there, it's supposed to be a bridge to enable us to transform our practice while we still remain very essential in decision making. Adaptability is the most important professional skill in the digital era. Ethical, responsible adoption is critical, and the future belongs to vets who embrace learning and innovation. Thank you very much. I hope I've been able to stay within 30 minutes. Thank you.
Thank you very much, sir.
Thank you so much, sir, for this session. It has really been enlightening. Thank you so much. My question now is more on the ethical use of AI for non-vets in treating their pets. How do we regulate that?
Yeah, can I take that question, moderator?
Yes, please. Thank you, sir.
Yeah, for every use of AI by non-vets in treating, well, I don't even have to call it treating, in addressing the situations in their dogs, if I heard you well, is quackery. So that is a misuse. We also have people who misuse AI, that they are more in number actually. So no one is supposed to use AI. They are off the cuffs. So that is quackery. So we are not supposed to encourage anyone, be they our clients or others, to. They can have information. Yesterday I said something about our readiness for more litigation, that it's not going to be impossible that some clients may ask AI for what a standard operating procedure to a situation could be. And if the answer or the responses from AI does not match what the client is observing us do, it could as well ask AI what next step you should take. And AI could just tell the person to go to court. So that is the much that AI will be able to do. So AI cannot turn clients to become veterinarians. No, it's not possible. So anyone who uses AI as a client is practicing quackery. I hope that answers that.
Thank you very much, sir, for that answer. Pius, I don't know if that answers you. All right, Pius, if you are speaking, you are muted.
Yes, sir. Yes, sir. Thank you so much, sir.
All right. Thank you very much. So thank you once again, Dr. Gani. We are so honored having you this evening and for that inspiring presentation.